This podcast is brought to you by GBS, where you'll find flexible education that fits around your busy lifestyle. For more information on GBS courses, visit globalbanking.ac.uk.
Well, we're very lucky to have Maggie Davies, the Chief Nursing Officer for University Hospital Sussex, today. We're interviewing her, and we've got Maggie. We're going to have three sections to this interview. We've got some questions about your life and your path into nursing. We have some quick-fire questions, and then we also have some questions from our students who are very curious to know about your career. And so. Thank you very much. Welcome to GBS, and we can just dive into the questions if that's okay. So, where did your passion for nursing come from?
Thank you, Stephen. Thank you for a fantastic opportunity to talk to you guys today, and also to the GBS students. So, my passion for nursing, I look back and think about it, I'm really sure it was always in my bones, in me. As a person, I was a big sister to two younger sisters and really enjoyed being a big sister at home, and then spent my sort of early years before I got to 10 in guides and brownies, and then St John Ambulance, where I learned some basic first aid training, which I actually really, really enjoyed. Yeah. But my grandparents were the biggest influence on me. My grandfather was a surgeon and my grandmother a children's nurse. So I spent a lot of my summer holidays with my grandparents. And I really enjoyed hearing their stories about their careers. So that was a huge influence on me. I then did a lot of reading about nurse training, what to expect. Keenly watched every episode of Casualty that came on the television, which I loved. That was a highlight of my week, watching Casualty. And then was fortunate enough to pass my qualifications, which meant I could go on and apply to do my registered nurse training as a non-degree student then. And started my training in 1986.
Gosh, well, and so what about your studies? Can you tell us a little bit more about your studies?
Absolutely, and it's something I'm hugely passionate about. So for me, I joined the profession as a registered nurse. It wasn't a degree pathway. I had the minimum qualifications to get onto a registered nurse training platform. I loved my training, and I know we'll come back to that a bit later, but really enjoyed my training. But always had a thirst for learning throughout my career. So when I passed my registered nurse qualification in 1991, I spent some time travelling, and then I went on to do some additional courses to bolster my registration. One was teaching and assessing, which I really enjoyed, and caring for patients following spinal injury. So that was my initial clinical interest. I then went on to do more cancer nursing work, which I've kept going throughout my career. It wasn't really till about 10 years later that I had an opportunity to revisit a degree opportunity for myself. And I did my degree in community nursing. Really enjoyed that. Again, got more of a thirst for more learning. So I was fortunate enough to find some funding to put myself on a master's programme. I did my master's degree at the University of Surrey into cancer nursing. And then much more recently, decided to do my doctorate qualification. So finished that 4 years ago, and delighted that I have a PhD qualification now. But it's been a long learning career for me, alongside my clinical career, which has been absolutely fantastic. I've been able to use both my clinical and my academic career to really bolster my clinical expertise, but also my leadership qualifications.
That's fascinating, and I suppose it's a lesson to all of us that we never stop learning, do we? I presume you're still learning, and I have a PhD as well, and even once you have your PhD, it's not the end, is it?
Absolutely not. And I think it's ever more important in the nursing profession, and the reasons for that are every day we learn more about the patients we care for, the treatments they need. And even when things go wrong with our patients and our families, we learn how to improve. So I'm really passionate that students, newly qualified nurses, and those further on in their careers get equal access to learning opportunities. And I actually worry when nurses say they've done their qualification, they don't want to learn more, because I don't think we should ever stop learning to be the best we can be at our profession.
Yes. So you say you enjoyed your training, and but what challenges did you face as a student?
It's a really good question. My student years were some of the best in my career, and I have incredibly fond memories of my training, not least because my grandparents trained at the same hospital that I did. So it meant a lot emotionally for me to retrace their steps, if you like, back in Barts where I trained. But some of the challenges you only really see when you've got through your training. And I was talking to a colleague this morning about her nurse training. Similarly, she trained around the same time as me. There's huge responsibility on 18-year-old shoulders then. So we were left in charge of big clinical wards, which was quite scary at the time. So there were some times where I thought, gosh, can I do that? So a lot of imposter syndrome. So you're not sure you're good enough for the job. And you have to really rely on the people around you to support you, mentor you, coach you. So those were some really, really happy memories. But there were challenges, different specialties. So lots of exposure to mental health training, pediatric, midwifery. So you learn quite early on where your strengths are and where your weaknesses are. But I'd always encourage the students to look at those placements and take whatever they can from those placements along the journey, and always feel that there might be a specialty that you haven't tried, which will equally excite you.
Yes, well, thank you. And then you said a little bit about your grandparents. Who's been the biggest influence on you personally then, out of the surgeon or the nurse?
That's great. I think my grandmother,
really,
absolutely, both as a nurse and a mum. She had 4 children. So my grandmother, huge role model for me. Lots of the values and beliefs that I still believe around kindness to our patients, our staff, run through me. So my grandmother's hugely influential on my career. But alongside my grandmother, I was very fortunate in my early training to be mentored by a staff nurse who stayed with me forever as a role model. And she was inspirational for me around the extra mile concept in nursing. We talk a lot about nurses going the extra mile, whether you're students, staff nurses, ward sisters, the difference you can make to families. So she was inspirational in showing me what the extra mile looked like. So doing a good job, but much more, what else can we do? How else can we help this patient, this family? What does outstanding care look like? And she really role modelled that for me.
That's amazing.
And she was, I remember her to today, but she influences me every time I'm in my uniform out in our clinical areas. I think of her. She was really inspirational for me.
We all need people like that, don't we, in our professional lives? And it's a great privilege to meet them as well, isn't it? You have an important role at the hospital, which must be very demanding on your time. How do you achieve a good work-life balance? And how do you find time for family and friends and other commitments? And then what advice might you give to anyone who's balancing studying with family job and other commitments?
And they're really important. They're really important questions, because if you want to have a lifelong career in nursing, many of your students would have worked hard to get to this position, to start their training. And I think the job is tough. And now it's, we do have workforce gaps, and there's a lot of demands from the public and ourselves and the profession about what good nursing looks like. So it is important that we look after ourselves, having ring-fenced time with family and friends, and using your time wisely at work. So managing your time correctly, making sure you get everything done that you need to do, but also taking your annual leave, having your weekends off or your shifts in the week, making sure you're making time for yourself. So first and foremost, making time for you, and then your friends and your family. And studies. And sometimes it doesn't always run smoothly. And it's okay to say, I've got a lot going on outside of work. Can I have some help to rebalance my priorities? So look to those people around you if you need extra support, just to take a step back and rebalance your priorities. But it's really important that the well-being for a long, successful career, that balance is difficult sometimes, but we have to hold on to making time for ourselves and our friends and our family.
Yes, thank you. And then what getting started advice would you give to GBS students who are returning to studying? Because a lot of our students are returning to studies.
I think just learning those, relearning those study skills. So how you're going to access your computer if you need to, having a good filing system, having backups for all your files. My son's going through a degree at university, and we talk about this a lot, using your library time wisely. So what you're doing in the library, making a catalogue of things that you're reading so you can easily go back and reference that. So you're not losing time trying to find articles that you've read before. So really using your time wisely and being kind to yourself. It's a big thing to go back to studying when you've had a break or you've had a family. So really being kind to yourself, allowing yourself time to get back in the rhythm of it, and look at those deadlines, work back from those deadlines and allow for life to get in the way. So don't look at a last minute submission, but really challenge yourself to be early prepared and to try and beat that submission date just in case life gets busy and it becomes more pressured. Just to take the pressure off.
You sound as though you have a really good kind of level of management, and you've got a kind of good kind of competency in that, and that's part of the job, I would imagine, and the reason you are in this position.
Yeah, it is, but I'm not always good at it, so I have to remind myself to listen to my own medicine. So there are times where my balance absolutely goes out of kilter. Lots happening at work. It's hard then to get that balance, but just having to. The things that we know work, going back around it, making sure you're making time, getting enough sleep, eating properly, preparing for your week ahead. But it's not, and life gets in the way sometimes. Absolutely. So that's the bit about being kind to ourselves.
Absolutely. And we're all fallible. We all make mistakes, don't we? And
exactly. But ask for help. There's people around you in and out of work who want to support you. Yeah,
excellent. The last in this section is, finally, is there a skill or piece of knowledge that you learned at university that has such an impact that you still use to this day?
I think it's asking for help.
Wow.
I think whether you're working in the clinical environment, on a ward, you're in the library, or it's outside of work, there's people out there who can help you. So don't struggle on. If you need to just take a pause and look for help from support, it's okay to help. Ask for help. That's really important. And it's okay to not be okay. There's times we all need an extra bit of support. So just be kind, but definitely ask for help if you need it.
Thanks, Maggie. So, Maggie, we've got some quick fire questions for you that we have. We kind of ask all our interviews. So I'll just go ahead, okay? GBS have campuses in cities that we all love: London, Birmingham, Manchester and Leeds. What's your favourite UK city?
London by a long way. That's where I trained. And when I go back to London, I get off the train at Victoria and the buzz is there. And whether you're walking along the river or in a lovely restaurant or just out shopping, there's a magic with London.
There is.
Absolutely.
No, we quite like it, is there?
Really? No, absolutely. And it's a city that never sleeps as well, which is lovely.
Yeah, very good. Printed or digital books?
Oh, audio.
Ooh, very good.
So I'm a huge audio, and I'm reading a fabulous book at the moment. But audio for me, so my own well-being, if I'm going between sites, I often put an audio book on and just unwind as I go into my next meeting. So I love audio books.
What are you reading at the moment then?
It's called A Terrible Kindness. It was one of the Times bestsellers. I can't recommend it enough to your students. It's absolutely phenomenal.
Thank you.
A new author, brand new book, and it's absolutely brilliant.
A Terrible Kindness. Thank you. I remember that. Binge watcher, or do you take time with a good TV series?
I'm not a huge TV fan, but if I do watch TV, I probably do binge.
Oh, excellent. Yeah. Best work at the beginning or the end of the day?
So for meetings, for being a chief nurse, my best work is definitely done early in the morning. I'm often here early and I'll go out to the wards to meet my staff. As a student, definitely I was a late night studier. Oh, yeah. So my best work didn't appear till about 11 o'clock at night. But for my professional work, it's always done best in the morning when the hospital's quiet and I'm out meeting the night staff and the early staff as they come on.
Yeah. So what time do you start then?
I tend to come in very early. I come in about 7 in the morning to meet staff because otherwise I miss the night staff.
Of course,
That's just the way I work.
Well, me too. I'm a morning person as well. Deadline hitter. You've said it before, though. Really, you've covered it. But deadline hitter or deadline extender?
Deadline hitter, definitely.
Seems important to you, doesn't it?
Absolutely. And I think as I've got older and more experienced, I prefer to beat the deadline by getting it in before. I'm not a last minute person anymore. No, I always like to get things in early and on time.
Stay connected on holiday or turn off all devices?
I do stay connected, but not with work. So I stay connected with friends and family, but I do turn off my work. So I turn off my emails, etc. So I do stay in touch with friends and family.
That's kind of important, isn't it?
Absolutely.
Yeah.
Absolutely. Just to re-nourish and regroup and then come back refreshed.
Yes. TV or newspaper? Watch the news or read the news?
Watch the news or listen to the news in the car.
Oh, okay.
So again, my preference would be the radio in the car.
Yeah. Office-based or work from home?
Oh, neither. In the pandemic, I didn't spend one day from home, and I couldn't have spent one day away from my staff and my patients. I don't like being in my office, so I'm at my happiest when I'm out in the clinical areas.
Yes.
That's why I do my best work.
Yeah. Better to be street smart or book smart?
These are fabulous questions, aren't they?
Yeah.
I think it's street smart.
Okay.
I think it's about emotional intelligence, being savvy, doing the right thing, and what comes from your heart. All about authenticity.
Lovely.
So I'm going to go with street smart.
Excellent. Finally, the good old British debate, tea or coffee?
Oh, tea every time. And it has to be Yorkshire. That's my favourite.
Yeah.
Yes.
Excellent. I'm on Thompson's tea at the moment from Northern Ireland, but it's very much like the Yorkshire tea. But yeah, it has to be tea, doesn't it?
Absolutely.
So, Maggie, these are the last set of questions, and these are the questions that GBS students have sent and that would like us to ask you. So they're GBS students studying HND in healthcare practice and BSc Health and Social Care.
Fantastic.
So, what are my options for a career in midwifery once I've completed my bachelor degree in health and social care? And what advice would you have for anyone considering a career in midwifery?
That's a really, really good question. I'm going to answer the second bit first, if I may. So as part of my role as chief nurse, I'm also the board safety champion for midwifery, which gives me the fantastic opportunity to meet our midwives every day and to work in their unit. So this morning I was at St Richard's Hospital meeting our midwives on the postnatal ward and the delivery ward. So the career opportunities are huge for midwives, all the way from student midwife, qualified midwife, ward manager, and then director of midwifery. Many trusts have director of midwifery posts in their structure. And I think it's been a challenging 3 or 4 years for midwifery generally, nationally in this country and actually globally around the world. So there's been a lot of focus on midwives and the work that they do. And they do fantastic work, but there's no doubt there's some learning for all of us in terms of making midwifery as safe as it possibly can be. So there's lots of really good work on that. There are some short courses that are being commissioned for BSc students in health who can then do a short course in midwifery. And I believe there's one in the middle of England, not in this part of the world, but there are short courses to convert your BSc training into midwifery. So that's an opportunity when you're then a student midwife and you've done your clinical hours, then you'll be looking for a band 5 post as you qualify. And then your world's the oyster in terms of moving up the ranks to director of midwifery.
Yeah, thank you. What's the best advice you've ever been given?
Be the best you. Never try and be anybody else. And with that goes be totally authentic. So sometimes my job involves meeting families and patients when things haven't gone right. And there's a lot we can learn. That moment of being truly apologetic when things have gone wrong, and the human side of the nurse, the chief nurse, is so important for families. So always being the best version of yourself, never worrying about how somebody else is, whether you think they're better than you, what you could do better. Immaterial, just be the best you, because that's the one job we've got to do every day.
I love that. I love that comment about authenticity. It's
so important because patients and families will see straight through you.
Yeah.
You will get no job satisfaction for being anybody but yourself, and you give your best to your colleagues and your families and friends. So never try and be somebody else, just be the best you.
Thank you. For a career in nursing, do I need to have an extensive knowledge of chemistry?
No, you don't. But it's good to know about it because your patients are much more interested in these type of conversations now. So why are you giving me paracetamol, not something else? Patients want to know more about their treatments. So a good knowledge is important. Because then you can give the best care if you're able to explain, we've chosen paracetamol as opposed to this drug, and this is the reason why. So I went and did a pharmacology module in my master's because it's an area in my skill set I didn't feel I knew enough about. I didn't do separate sciences at school. I did general sciences, and when I finished my nurse training, I thought this is an area in my master's I really wanted to focus on. I learned a lot about how medicines work and the chemistry of medicines, which was hugely helpful to me in my clinical career. So don't shy away from it, but don't overthink it as a subject in itself. Look at it from a pharmacology point of view.
Excellent, thank you. And can you explain the bands in nursing? I mean, I don't know about the bands in nursing.
They're pretty complicated. I don't quite know why nursing's ended up with such complicated bands, but an entry point for healthcare assistants is a band 2, and that's the entry point in the whole banding range. And to become a qualified nurse, you qualify as a band 5. As a junior ward sister, you become a band 6. Band 7 is a ward manager or a sister. 8As are usually clinical nurse specialists. And then the management roles kick in. So nurse consultants and heads of nursing are usually about an 8C or an 8D. And then it lands on a 9. Very few 9 roles, but there are some. And then it goes off the scale there's no banding for director posts. So the most posts in nursing are band 2 all the way up to 8A.
Okay.
And they're set nationally each year, and any pay awards are awarded around that. I don't like to talk much about the bandings. I think it can create confusion between. It's about the role.
Right.
So I think it's become, I'm a band 5 nurse, so you're a newly qualified nurse, and that's how we want to portray you. The banding is become a bigger issue than it should. It's really about the banding. It's more important what's the role you're doing in the hospital.
That's excellent. Thank you. I'm considering a career in nursing, but have dyslexia. I'm very committed to succeeding in everything I do and have overcome many obstacles, but I worry that in nursing, my dyslexia may be an impediment. Any thoughts?
So I think clearly someone's very passionate about doing nursing. So I think it's accessing some early support to see if there are any adaptations that are needed and how we can support someone through their studies and then into the clinical workplace. There is a lot of excitement. I work with 2 or 3 people who have got dyslexia and they are excellent nurses. So it's not a barrier, but it needs to make sure that early on you've got the right advice and the right support to get through your studies, and then to make sure that you're applying for a job where your skill set would be matched to.
Yes, I have dyslexia, and it took years for it to be diagnosed.
Yes.
So it's not an impediment to a career.
No, absolutely not.
Very
absolutely
good.
Not.
Yeah. Would you encourage children in your own family to follow you into a career into the medical profession?
Oh, I absolutely would. No question. And it would be nursing all the way for me. And my son's at university. He spends all his holidays back in the hospital portering for us. He works at one of our sites and he's a hospital porter, and he loves that job.
Oh, really?
And he's done that for 2 years throughout the pandemic. He's been volunteering and now he's employed as a part-time porter. And he loves it. So I would recommend for anybody to join the NHS. Absolutely. It's the best job in the world and the best company to work for.
That's a great plug for the NHS, isn't it? Yeah. If I have a health and social care degree, BSc, is there an additional course that I need to do if I want to become a community nurse?
That's a really good question. The short answer would be no, because you can get community experience once you're qualified. I did a community degree as my first degree when I was taught in my career pathway. So there are additional courses you can do, but it wouldn't be a mandatory requirement. But if you wanted to be a district nursing sister or a community matron, you would be required to do additional training thereafter. But you'll be able to go straight in once you're qualified with your degree.
Yes. You've kind of answered this question, by the way. But I'm going to ask you again, it's a slightly different take. But someone's asked, which one of your grandparents you most like? And why?
Oh, goodness me. I am quite like my grandmother.
Yeah.
Her name was Sally. So I am like my granny. But there's a bit of Frank, who's my grandpa, in me as well. So you probably get a bit of both.
Yeah.
But certainly I think I'm more like my granny in many ways.
Yeah. Thank you. We're all an amalgam, aren't we?
Yeah, we are.
Yeah. What's the quickest way into nursing? Someone asks, following an HND in healthcare practice, or should I do a full nursing degree or work as an auxiliary nurse?
So the quickest way is to do a degree now. It's a graduate profession. That changed about 8 years ago. Nursing became a totally graduate profession. So there wasn't any other entry route in, which is why it's so important that we have a widening participation model in this country. I firmly believe in that. There are some excellent healthcare assistants that we would want to go off and do their nurse training. So doing the degree is the quickest way. For me, I started my career as a healthcare assistant, nursing auxiliary in a special baby care unit. That confirmed for me that I wanted to do my nurse training. So that was a critical point. Doing that clinical work to make sure you can cope with the hours, the shift work, and what the job entails is really important. And I think you can do healthcare assistant. Many of our students here are also healthcare assistants part-time. They go through to their studies and work 1 or 2 shifts a month for us, additional money, and they come out with really excellent experience and the nurse qualification.
Oh, great. A couple more. To be a paediatric nurse, are there any special requirements? Do you have to have any? Do you have any special advice for someone considering this career?
It's a fantastic career. It's probably the most diverse aspect of nursing as it currently stands. There's the neonatal aspect, that's the tiny babies that we look after in our hospitals, all the way up to teenage children and adolescents with complex mental health issues. So it's a very diverse branch of nursing, and I would recommend anybody to really consider it who would bring some skill set to the wide branch of paediatric nursing. It does require an additional qualification. And again, fantastic opportunity to get some healthcare assistant experience alongside your training if you were thinking about doing that area of work.
So Maggie, if our students were considering to come work here, work for you, what would you say?
Well, we have fantastic opportunities at UH Sussex. We are the 5th biggest trust in the country. We go all the way from Chichester down in West Sussex, all the way to Brighton, which is our tertiary hospital, and up to Princess Royal in Haywards Heath. So we are a huge trust, and that brings fantastic opportunities with it. For rotations, so students who would like to try a bit of different specialties, we have the full range within our trust. Also for midwives who are thinking of qualifying and working with us, we have a fantastic opportunity to work in a neonatal unit at our Brighton site, but also in our home birthing service and our continuity of carer. So we offer a wide range of clinical opportunities, some of the best in the South, there's no question of that. But alongside that, really importantly, a fantastic place to live. We talked about work-life balance by the sea, with the Downs, fantastic opportunity to get involved in some local activities. It's a very vibrant and lively part of the world, Sussex. Also, real commitment around learning and development. We touched on that, Steve, but we have clinical academic careers for our nurses and midwives. And those that are coming later to the profession, opportunities to go off and do some modules and some courses both at Brighton, Portsmouth, Chichester and Surrey. So we have a wide range of universities around our hospital supporting our students. And we take wellbeing very seriously. We have a lot of wellbeing programmes alongside for all our staff. So any of your students listening who'd like to come and work for UH Sussex and work with me, please tell them to get in touch. I'm sure there's a new chief nurse out there somewhere, one of your students.
You said that, didn't you? What did you say? You're telling me about when you go to speak to students at colleges, at schools?
Yeah, absolutely. So when I'm lucky enough that I go through an induction with all our new students at Brighton, Surrey and Chichester, and I say at the end of the meeting, one of you here will be the next chief nurse. And they say, no, Maggie, we won't be the next chief nurse. I said, well, I said that 35 years ago and I sat exactly where you were, and I never thought I'd be the chief nurse of this fantastic hospital. So one of you will be there. Dream big.
Thank you. Great place to be. Yeah.
Absolutely.
Well, and our last, thank you, Maggie. And our last question, does a health visitor need to be a qualified nurse? And have you ever worked as a health visitor? And is it a career you might recommend?
So health visiting used to not be a requirement and still isn't a requirement to be a registered nurse. You can be a registered midwife or public health nurse to be a health visitor. So it's a very diverse role. Looking at public health issues in the community. It's not something I ever considered for myself, but I think it would be a fantastic career for somebody who's looking at a broader community experience. So I would recommend it, but look also, it very, very keen is looking at public health and health inequality. So it has a special skill set, health visiting.
Thank you. Well, Maggie, thank you very much. The way we came to you was by a colleague of yours, and I said, we're looking for someone inspirational. And he said, I have just the person. He said, she's outstanding and superb and inspirational all at once. And I'm sure you're going to be an inspiration to the GBS students as well.
Thank you, Steve. Thank you very much.
And thank you.
Thank you.
Thanks for listening to this GBS podcast. GBS is a provider of higher education with flexible courses in business, finance, accounting, healthcare, technology and construction. With courses from HND to bachelor and master's degrees and study options that include weekdays, evenings and weekends, there's a course that's right for you. Visit globalbanking.ac.uk or email the GBS team at admissions@globalbanking.ac.uk.